It is important to know that any technique or new approach that you decide to include in the dental practice require a learning curve, both at the clinical level and in the organization of work with the whole team. Dr. Preda is a general dentist with special interest in implant that she applies in her practice in Sibiu, Romania. She has started in the Implant Master course in order to keep herself updated, and she always looks for new techniques to implement in her daily work.
Hello everyone, I am Dr. Sorina Preda. I am a general dental practitioner with special interest in implantology. My surgery is currently based in the beautiful city of Sibiu in Romania. I have qualified in 2007 and starting placing implant in 2012 after 1 year diploma course in implantology with AstraTech Dentsply back in England. Currently I'm studying for my PhD in implantology back in Romania. Today I'm gonna speak a little bit about the approach to dental guided surgery as a new user, to BB dental guided surgery. I've been introduced to BB dental implant system back in 2018, where I've discovered the digital workflow for fully guided surgery. In the past I have used guided surgery, but only for the pilot drill, for 1 or 2 implants. But after following the digital protocol for guided surgery, I gained the confidence to move from placing 1 or 2 simple implants to a little bit more complex cases. With the help of BB dental protocols, I was able even to restore all on 4, all on 6, and also being able to avoid bone grafting in different cases. To be able to have a surgical drill guide made, we have to follow a digital workflow well set in place for fully guided surgery. First of all, the clinical exam, where you establish the diagnosis and an initial treatment plan with the patient. Then the paraclinical exam, a CBCT X-ray with a radiographic template or without, depending on the case. For a full edentulous case, we will have a CBCT X-ray with a radiographic template in the mouth. For a partial edentulous, we don't need the radiographic template. Then a digital or classic impression. If it's a classic impression, you're going to have the model of the mouth. The model of the mouth is going to be scanned. All of this information, so the scan of the mouth plus the CBCT X-ray, the files from the CBCT X-ray, they are going to be uploaded in an implant software planning. BB Dental is offering a free-to-use implant software planning, which is very good, I can say. You can plan, design your case, or it can be done for you. After planning the position of the implants, the angulation, and after designing your surgical drill guide, it can be printed by your dental lab or by BB Dental Lab. Be sent to you, the implant placement, and of course the temporary or the final prosthesis, depending on the case. Today I'm going to focus on one of my first challenges, one of my first cases with the surgical drill guides. This is an initial case, it's a full edentulous case. The patient presented to the surgery with all existing teeth with mobility and infection, female, 45 years old, very young. The patient refused the idea of teeth in 1 day. She wanted to make sure that the result at the end is going to be exactly what she wants. So we've proceeded to the full clearance of the mouth, and we've constructed 2 immediate full removable prostheses. Choosing this approach, you have the size, the correct size, the correct shape, length of the teeth, making sure that the occlusion it's correct, and the patient is happy with what's going to be the copy of the final case. We leave the patient to heal for 8-12 weeks. In this case, we left her for 2 months. We've checked the gum healing. If you're happy with the gum healing and you think it's kind of complete, we move along in constructing our drill guides, our case. Because the patient didn't want to leave the dentures with us at all, we had to create some duplicates. The duplicates are going to be used as a radiographic template for the new CBCT X-ray. Before doing this, we need to reline the dentures because we need well-fitted dentures. We take impressions with the dentures in the mouth. We have the models done. Then we take the CBCT with the radiographic templates in the mouth. On the templates, we are going to have some radiopack markers because we need to align all of the files at the end. So we take in the CBCT. We send to the lab the models to be scanned. We send to the lab the radiographic templates to be scanned. And then we make sure at the end of the preparation we have three files ready. The DICOM files after the CBCT with the radiographic templates. The 1STL file containing the scan of the radiographic guides, and 1STL file containing the scan of the model of the mouth. All of these 3 files, they are going to be uploaded into BB Dental implant planning software. Here you have 2 options. To design the case yourself, if you're good with the computers, if you like to play around, if you have time to do that, you choose the angulation, you choose the correct implants for your case, measure the bone. Or if you don't want to do this, or if you don't have a lot of time, or if you're not a fan of technology these days, you can send the 3 files directly to the BB Dental planning specialist, and they are going to help you with it. After the case, if the case is designed by the planning specialist, with your approval, after you check it, they can print the surgical guides for you, or they can send the file with the guides design. That can be printed by your dental lab. I have chosen for my guides to be printed by BB Dental lab back in Italy. They look like this, and they are posted directly to the surgery. The good part in choosing to have the guides planned by the specialist is that along with the guides, you're going to receive a full report of the case. The full report is going to contain the implant you need, the multi-unit abutments needed for each implant after placing, and even the drill sequence to be used for each implant at the day of the surgery. This is an important tool because it saves you a lot of time and saves you faffing around the drill kit, choosing your drills, choosing your pins. So everything it's done for you in the box. Day of the surgery, make sure you have everything you needed. So you need definitely the surgical guide, you need all of the implants, BB dental implants, the multi-unit abutments, because you're going to start restoring the implants immediately after placing. The guided surgery drill kit. In the photo you're seeing the old version of the guided surgery drill kit. As I found out a few weeks ago, is that BB Dental designed a new improved guided surgery drill kit. Definitely have the report printed or have it somewhere around you, because it's going to be an important tool for your drill sequence in the surgery time. And definitely make sure that the patient it's ready for the surgery. The procedure of the surgery itself, first of all, check the fitting of the drill guides. Make sure that they fit in the right place, that they don't move. Make sure that the patient is quite comfortable with them, as much as they can be. Then proceed with the surgery itself. As you can see in the photo, using fully guided surgery gives you a flapless procedure. Only with the puncture, good visibility, because you don't have a lot of bleeding. We don't have the patient choking with blood, with saliva, with everything else. After that, of course, you follow the drill sequence. You place the implants, upper and lower, and then you start restoring your case. I need to add up that I've seen the patient the next day after we've placed the implants, and I was really pleased to see that the patient didn't have any swelling, any bruising, and she didn't accuse a lot of pain. So the patient was quite comfortable after all of this, especially because she chose to have both of the cases done, both of the arches done in one day. So she was really brave. Immediately after placing the implants, you need to check yourself with a panoramic radiograph. It looks like we've done the right thing, so the angulations of the implants are correct. With this, you make sure that what you have on your plan, it's in the mouth, it looks okay. And then you start restoring. Of course, you place the multi-units into the implants exactly as you have them on the report. And you start taking the impression. I have chosen in this case to use closed tray impression because the patient was tired after the surgery. She had a good opening of the mouth, but not massive, and this was the choice I've made. I tend to place the multi-unit analog into the impression myself to make sure that nothing is moving, everything it's set in place. So make sure before you send the impression to the lab. After this, both of the impressions, they were sent to the lab. We had the copy of the bite from before, but we've checked it again. Next day, we've done a try with the tilings in the mouth, glued with composite, to make sure that everything is fitting on the multi-unit. After that, because it was a double case, we've decided to print the version of the teeth in PMMA to make sure that the bite is okay, the shape is okay, patient is happy with what she's gonna get in the end. So as you see, bite registration, try of the metal frame, try of the bite with the PMMA teeth. After everything is done and you're happy with the position, the patient is happy with the size, the shape of the teeth, we move along in making the final prosthesis. Patient chosen zirconia prosthesis, which I think they look amazing because she's a young patient. They look like this. We left a little bit of space for hygiene. Instruct the patient how to clean. Make sure the patient is aware that she needs to come back every 6 months to check, and at least one panaural once a year. Happy smile, the patient was over the moon. The advantages of the guided surgery. First of all, for the patient, flapless surgery, non-suture procedure. Very comforting for the patients, even from the beginning, even from when you plan your case, because they tend to choose non-cutting, non-stitching. They are very, very happy with this approach. It changed the way that my patients are seeing this procedure. And definitely after you've done 1 or 2 cases, the patients are gonna talk about it around, and definitely you're gonna get more in, because it can be done with no cutting, no stitching. We get predictable results because definitely you get in the mouth. The result in the mouth on your post-op x-ray should be exactly or near the plan you've done on the software. So definitely you are more comfortable in achieving this result. You're not worried about, oh, my hand moved, the patient gagged, the patient choked. So definitely predictable results. Better tolerance for the patient, as we said, because it's shorter surgery time, it doesn't bleed a lot, so the patient tends to accept it easy. Shorter surgery time, as we said, because you don't have to raise the flap, you don't have to stitch a lot at the end, especially in this case with the double arch. It's a reduced cost for the patient, especially with this approach, because the patient avoided, and we've avoided the temporary bridges, because the patient wanted to wait for those 2 months for healing. And definitely it's an important proof in managing possible complaints, is because you have everything done the correct way, plan it on the software, building a very accurate surgical drill guide, the x-ray after that. Definitely it's an important tool, especially these days where the rate of complaints are quite high. The disadvantages of the surgery: you have to make sure from the beginning, so from the clinical exam, that the patient is able to open the mouth wide enough. If the patient has a very small opening of the mouth, they are not suitable for guided surgery, for full guided surgery, because the drills from the guided drill kit, they are longer, way longer compared to the normal drills. So definitely make sure you measure the opening before you start building your case. This is the first step you have to check. The gag reflex. Some patients do have a tiny bit of gag reflex, mainly from the upper surgical drill guide, but only a few patients. Then you make sure you can adjust it, you can make it a little bit smaller, tiny bit. But considering in this case that the patient had dentures, it wasn't a problem. The disadvantages, so definitely the need of short or narrow implants. For the moment, the short or narrow implants can't be done guided, so you have to choose to do it freehand. Maybe in the future things will change. And the human factor, the difficulty for the patient to keep the mouth open, TMJ problems, constantly the sensation of choking, nervous patients, but this can be manageable. In the end, of course, happy patient, happy dentist. You see here the patient with the nice smile. After this case, which was my first challenge, I can say, things became better for the surgery. I became more confident in doing these cases because with the right help, with the right tools, definitely with the help of BB Dental, day-to-day surgery, it looks easier, it's nicer, and the patients are leaving the surgery happy. Okay, let's move to it. Great. Fuck.
Click on the link below and contact us for more information.